that this is not unexpected. This is not unexpected. It was literally 6 days ago when I instituted an executive order to give me the powers I would need to deal with the current situation, but also a future situation which could arise if Omicron ended up showing up in the state of New York. And we believe it has. Just recently we learned from the Department of Health in Minnesota that one of their constituents has tested positive for Omicron. This individual had spent time in New York City. They were at a conference at the Javits Center. We have been in touch with the Javits Center. I just spoke with Alan Steele a few minutes ago. I've been in contact with New York City, spoke to Mayor de Blasio. An individual I'm going to be introducing shortly, Dr. Mary Bassett, our new health commissioner, has also been in touch with the New York City Department of Health. The information is still evolving, but we understand that this individual, while they were vaccinated, they have very mild symptoms, and in fact those symptoms have already resolved. That is good news. And what we want to make sure we know is that there is one way to address this. New Yorkers, get vaccinated, get boosted, and get ready. We do anticipate there'll be more cases, but to the extent that they are mild, we'll address them. This is not cause for alarm. Again, it was foreseen ever since it was first reported out of South Africa that we knew it would come to New York State at some point. And I want all New Yorkers to know that their state government, in collaboration with our local governments, our cities and our counties, are prepared for this. We are ramping up our efforts to get more vaccinations out there, ensuring that there's no area of the state where someone cannot easily access a vaccination, but we believe that the vast majority of the state is covered now. Testing is widely available, and we encourage people who have been at a conference recently at the Javits Center during the dates of November 18th and 22nd that they also get tested, and we're going to make sure that everyone knows. We have a way to contact these individuals. There is a list of individuals who attended, and also they were vaccinated in order to go into this conference in the first place. So no confirmed cases in the state of New York. However, we are very cognizant of the fact that it is very likely soon that someone is going to test positive for this. We've been ready. We're prepared. We're not sounding the alarms. We're not overreacting to this. But I want New Yorkers to have the confidence to know that we are ready to deal with this. So continue wearing your masks. We encourage everyone to wear their mask when they're out. Get those shots. Get your children vaccinated. And we're not defenseless. We are not defenseless against this variant. And I want everyone to know, to have the confidence that we can handle this. We're ready for it. This is not surprising. It is the 4th variant that has arisen, and there's much more information that is still to be learned as we wait the continued research from the CDC and others. I have spoken to individuals from the White House yesterday in person to be briefing our congressional delegation to make sure they were apprised of our efforts here in the state of New York. Constant communication with our county officials, our public health departments, and so we are ready. Unlike what happened in March of 2020, when there was a shock factor involved, when people did not know what to expect and how long it would last and how to take action and whether there would even be a vaccination. We're in a far better place today than we were at the start of this pandemic. So I don't want anyone to panic over this. Let people know there are steps we can take, and we encourage everyone to do this. As I mentioned at the outset of my administration, which is just a little over 3 months old now, I said I was going to assemble the absolute best and the brightest to ensure that I was surrounded by a top-notch team to deal with all the issues that state government must deal with. I wanted someone who had the knowledge and the expertise, in particular, to be able to handle working side by side with me in addressing the pandemic. I have found that individual, and that person who has the experience, the fortitude, and the aptitude to be able to deal with this crisis is Dr. Mary Bassett. She's a highly regarded public health expert, an exemplary public servant. She grew up in New York City, a BA in History and Science from Harvard University, medical degree from Columbia University, master's in public health from the University of Washington, and she served as the commissioner in New York City, the commissioner of Department of Health and Mental Hygiene, and has worked to address health disparities and inequities in New York City. So I'm very excited to have her at this moment to address her reflections on her new position. I have utmost confidence in her, and we will work very closely together. As everyone knows, as I've said from the beginning, I'm a very good listener, and I do take direction and advice from the experts, and I have one of the nation's premier experts now at my side, and that should also give New Yorkers confidence. Ladies and gentlemen, let me introduce Mary T. Bassett, the new Commissioner of the Department of Health. Thank you.
Thank you very much, Governor. You know, this pandemic has really made a strong case for public service, and I thank you for the opportunity to answer that call once again. As you've mentioned, we are monitoring the Omicron variant in close coordination with the CDC, the Minnesota Health Department, the New York City Health Department, and I'm sure you'll have questions about that. But I want to start out by giving more thanks, including to the New York State Health Department, for its dedication, its service, and its sacrifice. I met yesterday with the senior staff. You know, to confront a pandemic is never easy, and I am so inspired by the caliber of that team, their dedication, and their determination. I'm no stranger to crisis. When I just finished my medical training, I moved to Southern Africa, where the world's worst HIV/AIDS epidemic was unfolding. And then some years later, as the New York City Health Commissioner, I encountered more microbes than I ever would have predicted. There was Ebola, there was Legionnaires, there was Zika. In 3 decades of public health work, I've learned the importance of truth-telling. I can't think of any better way to put it. I'll tell the governor what we know, what we don't know, and what our best judgment is, and I'll tell the public the same thing. Our knowledge is evolving. We are so much better equipped today than we were just a few short months ago, and as our understanding changes, we will change. That's how science works, and public health is based on science. If we needed any more evidence that public health is also rooted in social justice, COVID also gave us that. COVID literally pulled back the curtain on enduring and unaddressed inequities. Confronting this pandemic is a top priority, but it's not just a novel virus. This virus found its way through our failures. Failure to ensure the right to health care services, failure to assure available and high-quality primary care, in tackling obesity and other chronic conditions. COVID accelerated what's become a relentless tide of overdose deaths. And in our nation, all of these track along the problem of racism. We recently showed nationally among adults in this country in prime working age years that nearly 90% of deaths among people of color would not have occurred if we had death rates that are equivalent to that of white college-educated individuals. So it may seem like COVID has really opened up a Pandora's box. I hope that all of you remember that there was something left in that box, and that was hope. I have enormous hope about our ability to tackle this big picture. I've already watched Governor Hochul take bold steps to protect New Yorkers, and Governor, I really look forward to joining you in this effort. So I'll end my brief remarks with a reminder that there are small steps that each of us can also take that will make a difference, make a big difference. Get vaccinated. If you're already vaccinated, get boosted. Wear a mask. If you feel sick, stay home. Please be safe. We are all in this together. Thank you.
Thank you. Thank you very much. Now you know why I feel so confident in our ability to address whatever comes our way, because we have one of the nation's best at our side. So thank you, Dr. Bassett, for answering the call to public service once again. As I mentioned yesterday, I was in the White House addressing a number of issues, our COVID response as well as infrastructure issues. And I do want to thank President Biden. Some of the elements of his winter plan have already been released. This is important, and one of the difference, again, between our response now and at the outset of the pandemic in 2020 was a different president. And that required there to be people in other states who took leadership positions. And I'm really, really proud that our White House, President Biden and his entire team have taken the ownership and responsibility to make sure that we have a national response to what is a national, indeed a global crisis. And so one of the issues that we've been fighting for a while was actually reimbursement for over-the-counter tests. Up until now, we did not have the authority to have private insurance companies pay for people to get over-the-counter tests, and we've been pushing and pushing, trying to allow this to happen. And we just received word from the White House that they will require that insurance companies now cover the cost of over-the-counter tests to make sure that they're more widely available and that there's no barriers to access to those as well. So that was important. We also know that President Biden is pushing the ramp-up of pharmacies. As you know from the beginning, pharmacies have been one of the primary locations for people to receive a vaccination. They're so accessible. They have a direct pipeline to the White House to get the supply, and he's ramping up that supply, which we think is critically important. Also, more collaboration to get seniors boosted. Seniors continue to be the vulnerable population. When you look at the hospitalizations, they are primarily senior citizens, some who had been not vaccinated, some who were vaccinated, but getting that booster is critically important. So we're going to be reaching out to all Medicare beneficiaries with the federal government as well. Continuing to push the mass vaccination sites. We'll be talking about that, what we're doing ourselves, but also the pediatric vaccines and all this accessibility is coming from the federal government as well as requiring Medicaid reimbursement for providers. This is one way we can keep kids in schools, safe travel protocols, as well as a number of initiatives that we support. I just want to stand here today and say we support President Biden's bold initiatives, and so happy to have him as a partner who understands that the role of the federal government in addressing this, which was not there at the outset of the pandemic, and a lot of time was lost, and many people suffered, and I'm proud to see that dynamic since last January has changed so dramatically. Let's take a look at what's going on here again in New York State. We continue to see warning signs. High rates of cases across New York State continue to be higher in upstate regions compared to downstate, and there is only one reason for this, and that is the decision by individuals not to get vaccinated. It is not that there's not a supply. It's not that people are not eligible. It's not that they don't know about it. It is a conscious decision not to be vaccinated, and the direct result is a higher rate of individuals in those regions upstate, as well as it has a direct correlation to the number of hospitalizations. As you can see from this chart, we're not anywhere near where we were in 2020, but we never want to get anywhere close, and so you can just see the upward trajectory of the hospitalizations correlated to the areas in particular where people are not vaccinated. We're continuing to monitor those numbers as they increase. Some of them are starting to spike somewhat on Long Island and others, but this gets again to the number of individuals who are not vaccinated. Look at these numbers. I mean, we have one of the highest percentages of individuals over the age of 18 who are vaccinated in this country, but there is no reason why it's not 100%. Look at this. We also know that there's more people who have to be re-vaccinated, have to get their booster shot. So what we've been doing was we sent out tens of thousands of text messages, over 600,000 text messages to people who had received their one dose but did not get the second one. That one dose does not do the job. I don't know what people are thinking, unless it was a Johnson & Johnson. If you had Moderna or Pfizer, you have to get the second dose in order to make it effective. And even now we're talking a third dose. The third dose is the booster shot, and we have to make sure that we get that taken care of. We talked about this for months, especially last week when I announced the executive order, why we had to have steps taken now, because we know human nature. People were looking forward to traveling. They traveled a great deal during the Thanksgiving holiday. Only about now will we start seeing the results if people did contract the virus when they were with family and friends over the holiday. More people in airports, congested settings. So we're seeing exactly what we foresaw. And also, the more cases, more hospitalizations puts a lot of stress on the hospital system, which is why our executive order, which was instituted and goes into effect tomorrow, says that hospitals that have less than 10% capacity have to cease elective surgeries until at least January 15th, unless they're able to get those numbers higher, their capacity higher. However, the Department of Health is working to make sure that there's some flexibility within that. That is There's probably over 50-some hospitals that meet that criteria. The vast majority are upstate New York. We are responding with constant communication with the hospitals, the local health departments, and the elected officials to find out how we can backfill and get more healthcare workers in. It's not a shortage of beds. It is absolutely not a shortage of beds. It's a shortage of people to staff the beds. Again, think of how far we've come. Our healthcare workers, our nurses in particular, were called to do the extraordinary. They went through hell and back during this pandemic, and they all thought by now, almost 2 years later, that the pressure valve would finally be off, it'd be lessened. And that is not the case. So there is a high burnout factor, completely understandable. People that were close to retirement have left. Those who've just said it's more than I wanted to do are gone. And those who refuse to be vaccinated, that certain number, are also having an effect as well. So we recognize that what we have now is a situation where we have to do even more to increase hospitalizations. We're being creative. That's why I needed the emergency authorization to deploy the National Guard, the trained National Guards who have EMT or healthcare backgrounds. It can be taken from areas where there's not high need and be deployed elsewhere. And we have over 120 of those individuals that will be going particularly to nursing homes. When you think about why are we going to nursing homes, not the hospitals, there are hundreds of people sitting in hospitals today who could be discharged, again, non-COVID patients who could be discharged to long-term care facilities or nursing homes, except there's not capacity. So we take care of the capacity on the back end, address that, and then we can have more discharges, and that'll relieve the pressure on the hospitals and increase their capacity above the 10%. So this goes into effect tomorrow. We'll be releasing guidance very specific to the hospitals on what metrics we're looking for them to come out of this, or whether there's any flexibility to be had. Again, as I said before, we do not want people to put off important preventative screenings such as mammograms, colonoscopies, and others, because what we saw last time was a spike in people getting sick from other causes because they were not getting the medical care they needed. We do not want to have that scenario again. So that's what we're working on right now. We know the tools. The tools are so simple. It's the vaccination. It's widely available. Get the booster. Get tested if you think you've been exposed, and we'll be talking about that with respect to the individuals who participated in some of the events where the person who contracted the variant in Minnesota was, as we continue our contact tracing. Stay home if you feel symptoms, even slight symptoms. One of the advantages we learned is that people can work from home. There's no reason for many people in certain professions where it lends itself to that, where they can stay home and recover to make sure they don't spread it to other individuals. And keep wearing the mask. Keep wearing the mask indoors. So that's what we're focused on. Also, increasing our pop-up sites. We're having new pop-up sites everywhere, engaging, again, the clergy, what we're doing at schools and other places to make sure that the vaccines are widely available. And again, our booster update, I know we can do better. Look at the number of people over 18 fully vaccinated and boosted is only 16%. And our vulnerable population, 65 and plus, these are the individuals who got their vaccine the earliest. They got their vaccines, many of them last December if they were in a nursing home, or January, February. They were the earliest. They need to be told, which is why we're sending and making sure that all the nursing homes in particular have capacity to offer booster shots. But that 37% has to go much higher in order for us to address the problem, and also that'll help take some of the pressure off the hospitals. If we can keep them from getting sick because they have a booster, they won't go into a hospital, and that helps abate the situation we're in right now. So we're also trying to have more booster incentives. I want more people boosting. We're going to be announcing a number of incentives. One of them is free ski passes for kids at our state facilities. We'll be getting that information out to everyone. We're also announcing a major Boost Up New York campaign, a campaign to get people excited about getting boosted before the holidays. We'll have banners and displays and posters and all sorts of ways to get this information out. It shouldn't be necessary, my friends. It should be just in that category of course we'll do this. And we don't have a supply issue, we don't have a capacity issue in terms of getting the boosters out, but it's just a decision that people are making not to do this. So getting tested now, particularly as we start hearing about this variant spreading. It's in Minnesota, no known case in New York, but we anticipate we'll be seeing people testing positive soon, making sure that our testing sites are ramped up as well and they have all the supplies they need. We're going to be making sure that there's plenty of coverage for this. Some tests weren't covered by insurance again. We're making sure that they are, and that is a change from the White House as well. So there's plenty of places to get tested, pharmacies, urgent care centers, hospitals. So what I'm saying, there's no excuse. There's absolutely no excuse to get tested regularly. I got tested again today, get tested regularly. It's important to find out whether or not, even if you are vaccinated, you want to make sure that you're safe. Schools. This has been a troublesome area from the very beginning. The last thing we want to see are any more children who have to be sent home for a longer period of time. That experience, while necessary during the heat of the crisis, we want to make sure that more kids are back in classrooms because they fell so far. And many of them are going to have long-term consequences if we don't get them back in the classrooms. So what we've done is ordered another 1 million antigen tests. We're allowing departments of health to prioritize getting them to students. We're telling in our communication with departments of health, get them out to the schools as well, so there's no reason why we can't do that. So over-the-counter antigen rapid tests will be issued. They'll be now allowed for schools to use, to be accepted for kids to return if they had to go home because someone in their classroom tested positive. So we're getting those out to parents, and this is another tool we're talking about, issuing guidance on testing to stay. So focused on the schools, the kids need to stay in, and what I'm saying is if they can get, we're getting testing kits out to schools, getting vaccination opportunities out to schools. What parents should be focused on is getting their kids the vaccination now, whether through their own providers, local pharmacies, or in their schools, because as kids hit the holidays, they're not going to have that opportunity. They're going to be around a lot of family, they're going to be around older grandparents and older relatives, and we want to make sure that all the kids are safe and vaccinated before they come back after the holiday season again. So we're putting a major focus on testing in schools and vaccinations in schools. So we know how to do this. The answers are right before us. We can handle this, New Yorkers. We've done it before, we'll do it again, and we're going to do everything we can to keep New Yorkers safe and keep our economy open. With that, I will ask Dr. Bassett to come up if there's any on-topic questions, have her address them, and then we'll take off-topic afterward.
Governor, if you could talk about the contact tracing at the Javits, what's being done, what concerns you have about New Yorkers having been detected there, and the potential risk of someone unvaccinated crossing paths with someone who's there.
This information is brand new. We just got received notification from the Department of Health from Minnesota. I understand they just issued a press release on providing more details. As soon as they mentioned Javits, I immediately called the Javits Center, spoke to Alan Steele. They know that the organizer of the event that was the anime event, where the individual participated, they have a list and contact information for everybody who attended. So this will not be as complicated as it would have been in the past. Everyone had to be vaccinated in order to participate in the first place. So that's why we anticipate if people do test positive, that at least based on this first individual, that the symptoms will be fairly minor. This person resolved at home, they're actually over their symptoms, but they did get tested, and that was really smart, so we can contact trace. So we have a way to reach everybody. We'll make sure, and we already know this to be the case, we'll confirm that there are plenty of testing opportunities for people in our city and around the state where people may have traveled. People come from other parts of the state to go there, or in New York City. So that is something that we've done before. We're also working closely with the New York City Public Health Department as well. That's why I spoke with Mayor de Blasio. Mayor de Blasio and I will be doing a joint press conference. If there's more information that's developed, we talked about making sure that we are on message together so there's no confusion with the public, so people can anticipate a different area of collaboration when it comes to fighting the pandemic between the state of New York and the city of New York as well. So this is all brand new. The process is just starting. It has not begun yet because this is literally probably information that's about an hour and a half old. So, but we know what to do. We have the tools in place to do that. Yes.
Dr. Bassett, what is your take as we stand now on the risks of the Omicron variant, from what you've seen, from the conversations you've had? Because the preliminary information that Dr. Fauci and others have been talking about is that this might be a milder variant than first feared, and that people really shouldn't have to think about it too much.
Well, the most important word you used just now was preliminary. all of this, it's not even a week since the South African scientists both talked about and sounded the alarm about this variant. It does seem to be highly contagious in South Africa. There's been a rapid increase in positive tests, but it seems to have resulted in milder illness. But nobody really knows for sure. And I think that what we keep saying, what the governor has just said, the advice to get vaccinated, to wear your mask, remains the best advice that we can give the general public. It's good news that this individual from Minnesota is only mildly ill and seems to have recovered. And the news that comes in continues to suggest that it is not more lethal than other variants that we've seen. But we all are waiting to learn more.
Governor, given that there is this variant, I know you want to do testing on the Mta employees. Will that change in any way? There's 30% of the employees at the Mta are not vaccinated. Does this change your mind or your plans for possibly mandating that, a vaccine for them?
Right now, we're not making a change in that because they're all required to wear masks, and that we are monitoring their positive rates, and they are lower than the positive rates for the rest of the city. We're making sure that they are complying. There's no excuses. There's consequences if people try to evade this. They have to do this. And for those who are worried about the cost of this, I want to remind everyone that this is a fully reimbursed by FEMA expense. So the money that's associated with this, to make sure that we're testing them regularly, and particularly if you get the situation where someone has been vaccinated and there's a breakthrough, as we saw with this individual in Minnesota, that testing is more important than ever to be able to identify who has the virus, and that they then immediately stay home, stay away from people, and then we can contact trace. So we'll be re-upping all the contact tracing as well. That wasn't as necessary as more people got vaccinated, but now we have to understand as more information comes out. Again, there's no playbook with respect to this variant at this moment because the research and the study of the cases that are emerging is still being done. But once we have clarity on what that's all about, and whether or not the current vaccinations and boosters are sufficient, whether something else has to be developed. I talked to the CEO of Pfizer. He said if they need to develop a different response to the new variant, that it would take about 90 to 100 days, but they're working on it now, so that gave me assurance. It's a New York State company, and they know I'm very interested in this. And also making sure we have plenty of testing kits, which is why we ordered another 1 million antigen testing kits, so everybody has the tools available to them, unlike the early months of this pandemic when there was this mad scramble to be able to get the vaccine and get testing kits and everything else. And so I just continue to reassure New Yorkers that it's a very different landscape right now, and we don't have to have a knee-jerk reaction to what's going on. We're staying the course, upping up our response dramatically, but for everyday New Yorkers, continue doing what you're doing, especially if you've been vaccinated and have the booster shot, and wear your mask.
Dr. Bassett, what kind of testing is happening at Wadsworth right now? Other states have already detected the Omicron variant. We have one of the premier public health labs in the country. What are they doing to make sure that they're detecting this?
Well, the Wadsworth lab, as you've said, is a premier public health lab, not just in the nation, but internationally, and it has been doing sequencing of the coronavirus since December of 2020. They have ramped up their sequencing. There is an observation on one of the PCR tests that one of the signals is dropped. It's called the S drop. And they have not only begun seeking that in the samples run at Wadsworth, but working with a whole sort of collaborative of commercial labs and other sequencing labs are working to identify in a targeted way what might be an Omicron virus. We will find this. There's no question that it will be detected in New York State and in New York City, but it has not yet been detected. We have this case now, we have an exposure in the city now, and we are fully anticipating the identification. It is not a problem that Wadsworth is not performing its job. It is simply that it has not yet been detected.
Is it concerning that it hasn't been, though? That it hasn't
Thank you, Dr. Bassett. Governor, we're going to take some questions via Zoom.
Oh, from the, I'm not sure who's talking, but is that from
We call that God.
That's God. Well, I just want everybody to be aware of what a jewel we have in New York State in this lab. And the fact that we have not detected it may mean that it's still extraordinarily rare here, that it is the proverbial needle in the haystack. We now have an exposure. We fully expect that it will be detected in coming days.
All right. Thank you, Dr. Bassett. Anyone else?
Now we can go, Dr. Bassett. Thank you, Governor. We have some questions now coming via Zoom. Your first question comes from Marina Villanueva from the Associated Press. Marina, your mic is open.
Hi, Governor, and hi, Health Commissioner. I was wondering whether the least vaccinated communities or the communities with the highest rates of hospitalizations in New York should be mandating indoor masks, and whether your thinking has changed at all on nursing home visitation, and whether that should be restricted for now.
The nursing home visitation decision came out of the federal government, and we simply are following their directive. However, I would encourage all nursing homes to institute their own if they so choose, and to do not head off visitation, because I think we also saw, similar to the detrimental psychological impact on children who were not in schools, we saw a major decline in many of our residents in nursing homes. And the fact that we have such a high percentage of those individuals vaccinated, and also what we did not have before I instituted the mandate, is that we all have health care, all the healthcare workers in a nursing home are also vaccinated. So nursing homes are a safer environment than they had been in the past. We're not seeing spikes in nursing homes, and we want to be understanding of the needs of families, especially with very older grandparents and parents, and how devastating it was for that separation. But we're cognizant of all the tools at our disposal. We're encouraging mask wearing, of course, in nursing homes. We're encouraging people to be vaccinated before they go visit someone, but the population themselves, where again we're making sure that because they're vaccinated, we're making sure that there's boosters available at all the nursing homes. But we're monitoring this. Everything I say today, I know there's a qualifier. If circumstances change, we're ready to adapt, and that's been the hallmark of how we've addressed this thus far.
Thank you, Governor. Your next question comes from Dan Clark of PBS. Dan, your mic is open.
Hey, Governor, can you hear me?
Yes, Dan.
Hey, Governor and new Health Commissioner. Congratulations on the job. My question is kind of building off of Marina's question. So we're looking at these numbers upstate, positivity, hospitalizations. What level would they need to reach to prompt new restrictions from the state, whether it be a mask mandate in these areas, whether it be a vaccination mandate for restaurants like we see in New York City? How high do these numbers have to get to prompt those things to happen?
Dan, there's also a compliance issue. There's a compliance issue. What the concern we have is whether or not people, whether they have COVID or another illness that requires hospitalization, have the ability to get the necessary medical attention in a healthcare facility. That is our focus right now, and that is why I instituted the requirement that there not be elective surgeries in any hospitals that have less than 10% capacity. Otherwise, the hospitals can handle it. We're also working to make sure we backfill staff for individuals, for individual institutions. That has been a primary focus. We have encouraged everyone to wear masks indoors. We have really pushed individuals to get vaccinated. In our state workforce, for example, everyone's required to be vaccinated or test every single week, and that has been successful. But Dan, I know you know the difference in people's attitudes about vaccinations. We have 90.9% of individuals vaccinated already in the state of New York over the age of 18. That is phenomenal. But it's going to be hard to get that last 10%, and so we have to address the fact that that is a very good number. I'm proud of the New Yorkers who got vaccinated. We'll continue incentives, but also knowing that the localities, those who want to enforce this, are doing it, and we support them. But there's also a reality that it's almost impossible to enforce this kind of behavior among a population that just won't do it. That's what we're dealing with. That is the reality of this crisis right now. But again, the main focus is to make sure that individuals who get sick, that they have room for them to be taken care of in a hospital, and we're working on that intensely.
Governor, your next question comes from Josefa Velasquez of the city. Josefa, your mic is open.
Hi, Governor. Can you hear me?
Yes, I can.
Hi. A couple of weeks ago at an Albany breakfast, you had stressed the importance of people returning to the office for work. Given this new variant, has your position on that changed at all?
Again, we're not overreacting to what is now the fourth variant. We're still dealing with the Delta variant, but the good news is, and this was in reference to particularly Midtown, the offices that are there, and we all know the dynamic that's happening in Midtown if you live here. The restaurants are packed, the streets are crowded, the bars are crowded. Everyone is moving back. There's almost no rentals available in the city of New York at this time. People are coming back, so they obviously feel safe enough to go to places together and concerts and plays, and that is good. We're encouraging that. We believe also that it's important for the local economy for people to, whether it's on a flexible arrangement or otherwise, to come back downtown and go to their jobs so we don't continue to affect the economy. Now, I will always operate with the facts that I have them today. We know that there's a new variant. It's likely to show up in New York. We don't know whether the symptoms, particularly those who are vaccinated and boosted, are as minor as the cold. And that is not cause to say everybody hunker down in your COVID home and stay out of the work. We are not there yet. I will not cause a panic among the people of this state who have already been through so much or being an alarmist. I'm a realist. I will always deal with the facts in front of me. And the facts is we're still learning about this variant. We don't know. Yes, it can spread a lot, but it could be a lot of people getting cold-like symptoms, or it could be more severe, which is why I can, like this, deploy massive resources and massive policy changes now that I have the tool at my disposal, the emergency declaration, which I instituted to give me that flexibility just less than 1 week ago. Last one.
We just have time for one more, Governor. Your final question comes from Mike Gormley of Newsday. Mike, your mic is open.
Hello, Governor. Are you getting? Is there more that should have done? You reacted very quickly to all of these that come out, but are there some overreaching elements that you should have? Should you have in place plans for returning to the closing of schools or businesses or anything like that? Do you have that plan in place, or are you ready to implement that?
I'm not prepared to shut down schools or the economy at this time, no. That is not a necessary response. That would be considered an overreaction to the fact that this is not our first, second, or third. It's our fourth variant. We're dealing with it. And the difference between last year, and this is where I don't want to have everyone have this flashback to the early months of 2020, we have a vaccine available, a vaccine that we were told would take years to development. This is the miracle of science, is that this pandemic launched in the state of New York, March of 2020. By late November, December, we were able to start having people in nursing homes vaccinated, senior citizens vaccinated, and by March, everybody, 1 year later, could get vaccinated. We didn't have that at our disposal. We should not overlook that fact, that this vaccination and now the boosters have been extremely effective in curtailing what could have been wildfire going through our state. Imagine where we'd be if we did not have the vaccination. Then we'd be in a crisis situation. But just to give everyone assurances, I have prepared all the scenarios necessary to address the situation should it be resolved, and we're not there yet, or determined, we're not there yet, that different steps are necessary because we're as bad as we were back in early 2020. But I don't see a return to that as long as the vaccines and the boosters continue to work. So all the tools are out there. I can deploy them with just a word. My team is ready. We have constant communication all day long. The state is ready to react if necessary. But I will not overreact and send this economy spiraling out of control once again because it's taken so long to get back where we are. And now we have a defense that can be deployed, should be deployed, and should be in place to protect people, those who are not vaccinated, the last holdouts. I encourage you to join the rest of the New York family in making sure that everyone is safe, that we can get through this and finally declare an end to this, or at least be ready for variants. We also have something that is exciting, which is I spoke to CEO of Pfizer about. There can be medicine. There are medicines being developed that we didn't even have available to us. When those are widely available, when people who are symptomatic can resolve at home without having to go to a hospital and address their symptoms similar you would with the flu or other illnesses. So that's probably the normal we're going to get to, but continue wearing the masks will stop the spread. Get vaccinated will stop the spread. But I just want you to know, Mike, if that's your question, are we ready to do everything? Of course we're ready. Of course we're ready. It'd be negligence if we weren't ready, but we're not there. All right, thank you, everyone. Thank you, Dr. Bassett. Appreciate it.
Very quickly, I was just very curious to know, the former governor took a very statewide approach. Governor Hochul is, obviously has made it clear that she is deferring to the local health departments. I'm curious if you agree with that, or if this is the time to start thinking about a statewide approach, because acting not quickly enough was obviously a problem at the beginning of the pandemic.
Well, you can answer it, then I will answer,
Okay.
and she will also answer. I'm not sure how you say we don't have a statewide approach, given that my decision in respect to hospital capacity is statewide. My mandate that all health care facilities be vaccinated, all the staff in there, is statewide. Our deployment of resources is statewide. Our engagement. So what I've done is have a surgical approach that is part statewide where it needs to be, but also in areas like New York City right now, and this could change, where the infection rate is 1%, that's different than a place that has 10% infection rate. We don't need that one-size-fits-all approach, but I'm prepared to make everything statewide if necessary. So what I think is the hallmark of our addressing this is building on the knowledge we have of the past. We know it works. And ignoring local public health departments is not a strategy that I'm going to be engaging in. That was a big difference. It was only New York will be addressing this. Only New York will be making the decisions. Only New York will be staffing vaccination sites with our teams, as opposed to involving the local people on the ground who have strong opinions about this. And that's been how we've elevated our approach to this in a better way. But I'll let the doctor respond to this as well, but she knows what our approach has been. And I question your presumption that it's not a statewide approach. All we do is think about statewide and how we can respond to this. But where it pops up in a negative way, we have an opportunity to send more resources, send National Guard, send more supplies, send more people. And that's what's happening.
I really don't have much to add to that, except to amplify that I think we are possibly having a problem with language. There's a difference between having a coherent statewide strategy and having a cookie-cutter top-down strategy. And it's the latter that loses the capacity in local health departments, loses the trusting relationships that they've built with the people who live in their counties or other jurisdictions, and loses the know-how. We can't afford that. So what I think I hear the governor saying is that these partnerships matter to a coherent statewide strategy, and flexibility matters. It needs to be fit for purpose. So I completely endorse the strategy that is underway now. You are right to point out that we had huge fragmentation in the past, undermining of local health departments in the past. That time is over.
Thank you.
Thank you.
Thank you, everyone. Thank you.